Bless you. That's something that you might have been hearing a lot quite lately. In fact, you might have even said it to yourself around the people who are in your company. It's because the flu season has arrived and apparently it's reaching its peak. The NICD, that's the National Institute for Communicable Diseases, is currently running an online health survey of people who are experiencing symptoms. To get a better sense of what this is all about, we've got with us in studio Mvuyo Makhasi, who's the data manager at the Center for Respiratory Diseases and Meningitis with the NICD. In fact, he's also the study lead for the NICD's CoughWatchSA online health survey. And Mvuyo joins us now in studio for more. Great to have you. Thanks very much indeed for popping by. And you look very healthy to me, so I clearly no flu in our vicinity, at least for now.
Certainly not, yes.
It's good to see you. Let's begin by just understanding the data as it stands. I mean, anecdotally, we always feel like there's a whole lot more flu going around because of the people close to us. What are the numbers saying?
So at the moment, we have officially declared the flu season. It started by the 17th week, which is the 22nd of April, where we started seeing an increase in numbers that have crossed the thresholds that allow us to determine that the flu season has actually begun. I can't confirm the numbers at the moment, but we are seeing a steady increase in the number of cases, both from outpatient facilities, which are all the public clinics and private consultations, as well as public hospitals, where we are seeing an increase in the number of patients being hospitalized for influenza-related illnesses. So the season has begun, and we are expecting further increases, typically peaks around May, well, end of May to June each year. So we'll see how the activity looks like for this year.
And that's exactly what I was going to ask you next, whether you were seeing any kind of deviation from the pattern we're used to this year around, for whatever reason.
Yeah, so it's very difficult to predict early on what the epidemic would look like for the current season. So at the moment, all we can do is confirm that we are seeing an increase. And then as we get into the flu season, we will provide more updates in terms of our assessment around the impact and the severity of the season, because we are comparing retrospectively each year with the data that we've had from the previous seasons.
No, fair enough. So enter CoughWatch. It's an online health survey. You want people to participate in it. Before we speak about how they can do that, perhaps explain what the thinking is here around people's participation and essentially what you're hoping that data will be used for.
Absolutely. So CoughWatchSA is what we call a participatory surveillance platform for influenza-like illnesses, where we allow members of the population to report on a weekly basis the absence or presence of respiratory symptoms. So the reason we're doing this is to address some of the limitations with already ongoing sentinel surveillance efforts for influenza-like illness. So currently, when we obtain data for influenza-related illnesses, we rely on a network of public clinics and hospitals where we have surveillance officers who are nurses that then screen patients for respiratory symptoms, and then we would collect respiratory samples that we test and confirm for influenza at our lab. But these are limited in that not everyone seeks medical care when they have a respiratory illness, and we've got an issue of underreporting because our data shows that 25% of symptomatic respiratory illness is non-medically attended. So we are missing a substantial proportion of non-medically attended cases. So CoughWatchSA, by extending the data collection directly to the members of the population, whether they've sought medical care or not, allows us to then provide a complementary data set that can be used in conjunction with our sentinel surveillance data to interpret the data more accurately and ultimately to broaden the understanding of the community burden of respiratory illness. So our aim ultimately is to build an early warning system that allows us to respond more timeously to increases in influenza-related cases, and then we can issue out alerts and communications to the public much more earlier than we would if we were to rely on sentinel surveillance.
Fascinating. You've spoken about underreporting. During COVID-19, we also spoke about deaths that are simply lost to the system. The exact term kind of escapes me now, but I'm sure it'll come more readily to you. To what extent are you finding similarities insofar as flu is concerned? You I think quoted a 25% underreporting rate, which is quite substantial. That's a quarter of the flu cases in this country that we simply don't know about.
Yeah, so the problem is that when it comes to identifying influenza cases, there are a number of factors that determine this. The first is the severity of illness, right? So if people don't feel that the illness they have is life-threatening, they will not consult for medical care options. So now we've got a lot of people who over time have been comfortable with other means of care. So going to over-the-counter medications, home remedies, and finding other means of caring for the illness. So now that allows us to miss where those people are actually seeking care. Because currently, we don't have a systematic way of collecting health-seeking data in South Africa. We rely on cross-sectional surveys that are done either in cohort-based studies or health utilization surveys given either at various facilities where we ask patients if they've had an onset of a respiratory illness and what type of care they've sought. So by having a platform like CoughWatchSA, it adds the component of obtaining health-seeking care data where you can get trends over time, compare these trends over time, and with the issue of underreporting, we can then have a quantitative measure that explains the reason why we aren't seeing as many cases is because people are seeking other forms of care. And we get the opportunity now with the surveillance program to be able to provide that gap in the data that is missing.
Hopefully what also takes place throughout this process is some kind of awareness raising. I mean, one of the spin-offs, for lack of a better term, from COVID is that people really kept to themselves, and that's why we didn't see as many flu cases as we've seen, right?
Yeah.
Non-pharmaceutical interventions kicked in, the washing of hands, the distance.
Yeah.
From my vantage point, we've gone right back to where we were before COVID-19. And that's going to raise all manner of questions about whether or not, frankly, we're learning from ourselves about how to prevent the spread of illnesses, including something like flu, which people take for granted can be fatal.
Absolutely. I think what COVID-19 did expose is the gaps in the health education when it comes to respiratory-related illnesses. When we spoke about non-pharmaceutical interventions, such as wearing of masks and hygiene practices, these should already be standard practices that people do follow when it comes to illnesses. But it almost seemed like an event related to COVID-19. Subsequent to that, I think there's a lot of improvement in our health communication. There is an increase in alerts and awareness that is being raised around the importance of these non-pharmaceutical interventions. And with CoughWatchSA, for example, this is a website that also provides editorial content that includes debunking myths around influenza. It includes the importance of vaccination and the importance of being vigilant and aware during the season to minimize the acquisition of infection and ultimately the spread in the event where you are infected.
Speaking about debunking myths, people all over the place, including newsrooms where I've been, are convinced that there is a specific kind of flu making the rounds this year. And I'm sure you get this every year.
Yeah.
But, there's a sense that the severity is, a bit worse. How long-standing the flu itself is, in other words, the time taken to recover seems to be lagging a bit. Does that correlate with any kind of, substantial data that you've come across? I know RSV is also being thrown around there as affecting mostly young people.
So the first thing is that influenza is seasonal. So every year around the winter period, we see an uptake or an increase rather in the number of influenza cases. And we are still seeing the same strains that circulate. It might differ by season. It might differ by which strain is more dominant than the other. But there's no data at the moment that suggests that the current strains that are circulating are more severe than the other strains. However, during the flu season, we do expect an increase in morbidity and some cases that might be fatal. And when we speak about vaccination, especially the vulnerable groups, it's important to minimize that morbidity and mortality and ensuring that people are actually aware. But at the moment, there's no data that suggests that we should be more concerned that we have a more severe strain. At the moment, we are seeing the typical kind of strains that we expect each year, and we can only make that determination at the end of the season. Right,
and a flu vaccine is still probably one of the most effective tools to, push back against whatever strain is making the rounds.
Absolutely. And so part of our surveillance work is to confirm the strains that are circulating. Then those strains are used for the vaccine composition for the subsequent influenza vaccine, which attempts to ensure that the vaccine is well matched to the strains that are circulating. So it still remains the most effective way of protection, either against infection or severe illness where you might be hospitalized. And so people need to vaccinate as much as possible, especially now that the season has been declared.
Yeah, the V word is back again. And, it's become so politicized in some instances. It's morphed into such a contentious issue because of, frankly, what's in the public domain, right?
Yeah.
Because of COVID-19, people see vaccines through a particular lens, sometimes not always for the good. And I imagine that makes your work also a bit complicated.
Absolutely, because now you have to defend the science
Yeah.
before you can actually convince of the utility and the importance of having a vaccination. And it still remains, when it comes to influenza, the only effective way to minimize the severity or the impact of illness. Some people may still be infected but may not have severe symptoms. So it makes our job quite difficult to speak about the importance of vaccination if people are questioning the science already. But we've seen with the data that we've published that it is effective, it does work, and people just need to decide for themselves if they want to actually vaccinate and protect themselves for the season.
That's still what it comes down to. All right, CoughWatchSA, how do people become participants? How long does it take?
Yeah.
Do they need to worry about their personal information being out there?
So CoughWatchSA, it runs over the winter season and the flu season in particular. So this launched already on the 29th of April. And basically, it's a website where participants can sign up if they choose to. They'll go through the typical informed consent process as it is with any study. And then we asked two questions of the platform. The first one questionnaire is an inter-questionnaire that asks basic demographic data from the participants, any underlying medical conditions they might have, and vaccination history for seasonal influenza and COVID-19. Then on a weekly basis, there's a weekly symptoms questionnaire that is now sent out to participants where we ask if they have experienced any symptoms that week. If they have not, that counts as a successful submission. And if they have, there's a series of follow-up questions around the onset of illness and if they've sought any kind of care, if they've had any tests related to that illness, and any impact in terms of time lost at work or at school. So this data is then used to quantify the number of suspected cases in the population. So for example, for influenza-like illness, we are looking for a combination of a cough or a fever and a symptom duration within 10 days. And then we use this to determine the proportion of reported cases over the total cases or total submissions that were made for that week. And we compare this data with our sentinel surveillance to validate that what we are actually seeing from reported data is real.
Right.
In terms of the data protection issue, so the first thing is that when it comes to any health sciences research, you need to have ethics approval. So we have obtained this from VITS, Health Sciences Research Ethics Committee. And what they do is look at the study procedures to ensure that it is above board in terms of what we request from the participants. So this is the first sort of measure that we've done in place to ensure that our procedures are approved by an ethics committee. Secondly, in accordance with the POPI Act, which one of the tenets for health sciences research is you need to collect at minimum identifying data as possible. So in our platform, we aren't collecting identifying information such as national ID numbers, participants' residential addresses. The only piece of identifying information we do collect is the email address that the participants require to register, as well as the WhatsApp number for the service to achieve the WhatsApp link for the survey. How we manage the risk for this is that firstly, the user level data is stored separately from the analysis data. So that is the email and the WhatsApp number are stored different from the reported data, which means there's no way of tracing back the symptom report to the individual who actually made that submission. And secondly, the database is access controlled. Only authorized study staff have access to it, and we do have audit logs that track the activity. So all of these are measures put in place to ensure data privacy as well as the confidentiality for the participants to ensure there's no way to trace back and any breach of their data.
All right. Yeah, it certainly is a lot of information, all with a good cause. The website, will correct me if I'm wrong, is coughwatchsa.org.za.
That is correct.
And that's, I suppose, the website that people can use to try and participate in this. Hopefully, nobody tries to sway the data for whatever reason. I can't think of a reason why anybody would lie. But I imagine that's something you've already factored in your own studies. Thanks very much for popping by. Really appreciate this interesting discussion and the intervention, all for a good cause, as I mentioned. Joining us there is Mvuyo Makhasi, the study lead, Makhasi, I beg your pardon, the study lead for CoughWatchSA with the NICD. Once again, thanks for coming in.